We're going to go ahead and get started with our Commissioner Status Update meeting. Today's date is May 27th, 2025. The time is 10:03 a.m. In attendance are Commissioners Eberline, Duncan, and Matari. I'm going to call this meeting to order. Are there any changes to the agenda? Hearing none. Public comment? Hearing none. Our first item, Justice Building Update. It's a discussion with David Mendez.
Good morning, Board. David Mendez with Turner and Townsend Heery. And Jeff is going to join in with some comments as well. First of all, a progress update. We've had a little bit of a delay in having the punch list done, but the contractor assures us that they're online to get their occupancy certification by the 6th still. So we're on track for that. We have furniture coming in that following month. That's a Friday, and then following Monday we have furniture coming into the building. So we're still on track for that. Changes, I wanted to get a procedural question answered, if we could, on blinds. So 3 weeks ago we were talking about the potential for adding interior blinds, and also on we have blinds on the exterior for the south elevation. We added, you gave us authorization to pursue adding those blinds to the building. We had a ROM of $50,000. We've got the final number. It's kind of interesting. So we were in the 82-ish range for adding that number of blinds to the building, and that's what the ROM was based on at $50,000. We found that there's a discount if you have over 100. So we got 102 or 104. I think 104. 104 blinds that we added, and the price came in $3,000 less than what our original estimate was, because of that discount at 100 points. So the question to you is, do we need, since you've given us the authorization to pursue that, do I need to come back to you with that contract for Commissioner's signature, or is my authorization sufficient to go ahead and sign that?
Good question. It's more than the 25,000.
It is.
Yeah, so it's better to bring it forward.
Yeah.
Just to make sure there's no problems. I'm sure the auditor's office would be happy with BOCC signatures.
Okay. Jeff has some items. So on, we're well within our budget on the FF&E that I had estimated at the beginning of the project. We've got some other items when we occupy this space, so garbage cans, things like that Jeff has is going to add to that FF&E, and I'll give you an update on where our budget stands.
Yeah, and just for clarification on those blinds, what we're going to do is we're going to add them on the west side of the building at the exterior offices. So there were, roughly 18 blinds that we added into that order, and that actually brought the price down because of the volume discounting then that we got from going over 100. So just so you know where those additional blinds were going to go, it's that west side. So as the sun comes around in the late afternoon on the west side, we will are proposing to do those exterior blinds on those west offices. So that's where the addition is coming from on that. So I've been working on what I would call the miscellaneous FF&E. So those are things that we need to do to just have the building set up and ready to go as we get ready to open it. This afternoon, you're going to see on your business meeting, we have the proposal for the beam seating. That's that kind of airport style seating that would go in the lobbies outside of the courtroom for waiting for to go into court. So you'll have that formal proposal for your approval this afternoon. There are quite a few small miscellaneous items that'll be coming up. So we're going to need things such as vacuums, cordless vacuums, floor scrubbers, the janitorial items and equipment that we'll need to take care of that building. The small cleaning tools from mops and brooms, and the push carts and things like that. There'll be a small order for the janitorial product that we need to get that building set up. Trash cans, there's quite a few trash cans that need to go in the bathrooms, and then office trash cans and things like that. So all of those are kind of just on a list of things that we've been working on to get that building ready to set up for opening. And then there are a few other things that, have been misses or things that people have brought up that we should probably consider. So things like AEDs, we have those throughout the campus. I brought up in my budget for this next fiscal year, and you authorized me to go ahead and take care of the AEDs throughout the county. We probably should put an AED on every floor of that building as well. So we would include those in the FF&E budget. And as well as Narcan, that's provided, but, we'll make sure we have the Narcan stations in those areas as well. People have brought up some questions about public notice boards, so we'll need public notice boards before security screening as we go in, so we can put all the public notices. The bailiffs have asked for a court board in the entry where they put their court schedules. So all of those are just kind of small items that we're considering through this FF&E budget, but just so you know what we're working on as we're moving forward and wrapping this up. And then just a couple other things of note. So as we take possession on the 6th of June, people are starting to ask a lot of questions about tours. I think there's a lot of staff that would like to come into that building. And so, when we have the certificate of occupancy, that means the building is safe. It is available for people to go into. I think it would be appropriate to probably have some days where people can come tour the building. I would suggest we wait probably a couple weeks after we take possession, because we are going to have that furniture company coming in. They're going to be using the elevators to get the desks up into the 3rd floor and 2nd floor and things and set up. But, as we start to wrap up that, the desk setup and the chair setup, I think it'd be very appropriate to, have some open days where our staff can come and tour the facility and see that. And, and I don't know if we want public open houses on that, or, I guess that's something to think about, and maybe for you to give me some direction on what you would like to have for that as we look into the future. And then also for you to think about, is there some sort of a ribbon cutting that you would like as we, get ready to do a grand opening on this building, and what that might look like? I would certainly appreciate some feedback on what you would like for that. And then my final point on that is, just so you know, the Sheriff's Department has asked if they would be able to use the holding cells on July 4th, so that if they have problems downtown, that we could potentially use that as a temporary holding station. And we feel like we can probably make that work. That's just in that lower Sallyport area and the lower level holding cells. So
Mr. Chairman?
We'll work on facilitating that with the Sheriff's Department for the 4th of July weekend.
Mr. Chairman?
Yes, Commissioner.
I think it would be absolutely imperative that we let the public go and see what they paid for.
Yeah, no, I think that would be a good idea. So we should plan that. Maybe, and I like the idea of a ribbon cutting.
Yep.
Okay, good.
Commissioner Duncan?
Absolutely.
So if you want to go ahead and just organize that, plan it out.
Yes, very much.
So, okay.
So if that's 3 weeks out, that wouldn't be too long a period. I'm the only, Jeff mentioned that we're going to have unboxing of all the furniture and staging of that. It's going to happen over starting the 14th, or excuse me, the 9th. It's going to take about 3 weeks to get through the majority of that. So we'd probably want to have that out of the way before we bring people in to look at it.
That's fine, before people get moved in.
Okay.
Okay, very good.
So, anything else?
That's all I have.
That's it.
Thank you. Okay, on to item 2. Kootenai Health Partnership with Transit Departments, discussion item, and I have Katie Bobbitt.
Hi, I'm Katie Bobbin. I'm joined today by our CEO.
Push your button there so so people at home can hear you.
I'm joined by our CEO, Jamie Smith, today, and Michelle Bowie, and we just felt like it would be a great time to come and engage with you guys and start building a relationship moving forward. And so obviously there's so much change happening at Kootenai Health that we wanted to just come and speak to you and have you guys ask questions and continue from there.
Hi, good morning. I'll be leading the conversation, but certainly Michelle and Katie will add in, and we're obviously open to questions anytime. So we have a slide deck we prepared to guide us through some topics, but certainly can answer questions about anything you'd like. As Katie shared, I'm Jamie Smith. I'm the CEO. I still call myself the new CEO because I've been here for 17 months. Started in March of 2024, but certainly in that time period have gotten to know the community a lot better, been out and about. We purchased a home, have kids in school, and so personally and professionally feel much more comfortable talking to you today than I would have, a year ago. And so very much appreciate your service and your role and leadership for our county and want to, I think, in many ways, as Katie mentioned, establish a relationship so we can be a resource to you and vice versa. Because a lot of times we don't know what the next thing we're going to face together, and we're in this all together as a county and a region in North Idaho. So with that, we'll speak to the slides, and again, please have any questions that you'd like. I want to start out with a little bit of our strategic plan, and this is really Kootenai Health's North Star. We're focused on our patient experience, our quality, our people, and obviously delivering excellent care. And then we have to be financially healthy, and we have to grow. All those things make sense, I hope. But the key thing that we want to point out is that, you know, our mission is to provide health care to the citizens of our community. We don't exist for any other reason. We hold that very sacred. And the organization has really done a great job, frankly, over the many decades of adapting to that mission. And right now, the care we provide is sophisticated, it's best in class, and it's advanced. It's something you don't have to leave the community to go get, and that we're trying to make it better every day, right? It takes a daily commitment to that, whether it's a service, whether it's a new piece of equipment, whether it's a new facility, we're always investing. So we have a wonderful executive team, full of talented people that could be working anywhere in healthcare, anywhere around the country. Michelle is also relatively new, right, within 2.5 years or so. But we do have a mix of people who have been here for, you know, over a decade. We have some people in that mid-range, and we have some newer folks. So it's a really nice mix of people and talent. And as you can see, we're now recruiting for a chief operating officer, Jeremy Evans, who is with us for the last 17 years, just retired. And so we're in the process of replacing that position. But this is our team, experts in every field, HR, IT, clinical, strategy, et cetera. And as you know, we're organized as a 501c3 now, Kootenai Health, and so this is our governing board. It is 11 wonderful individuals from this region who represent really every facet of life here, whether that's business, healthcare, investing, clinical, and we added 2 seats last year to this board, so we now have 11 members. And one of those is Sean Kehoe, whom I think many of you probably know from Sandpoint. We wanted to make sure to represent some of that northern population that we serve. But all of these folks, aside from Sean, live in Kootenai County and represent the community. And so we're thrilled with our board. To kind of go back in history a little bit, of course, I was not here for any of this, so I'm doing my best to convey what happened. Michelle and Katie were both eyewitnesses, so they can chime in. But we did make a transition officially in January 1st of 2024 to a private 501c3 organization, leaving the hospital district model. And the hospital had been a district for 50 plus years prior to this, but really, in the estimation of the board and the leadership, had outgrown that model. But the process was transparent. There was a lot of discussion. As you know, the state legislature did pass House Bill 603, which allowed district hospitals to go along with county hospitals that had this right to convert already. It's very common across the country as well. We did a lot of due diligence around this, produced a white paper, had some consultants weigh in pros and cons, and then posted all that, had public meetings, et cetera, and really determined it was the best move for the health system at that point in time. Again, we did solicit feedback, and then the final decision was made in May of 23 with a unanimous vote, one abstention, I think, with that vote, from our elected board. So the elected board voted for this transition. And it was completed again on January 1st of 2024. The district itself now still exists. The statute requires that for at least 2 years, but it has virtually no function. It only holds the assets of 2 frozen retirement accounts and doesn't have any business to conduct otherwise. It could theoretically levy taxes still, but that wouldn't be necessary because it has nothing to fund. In our new format, we are still locally controlled. The world headquarters of Kootenai Health is in Coeur d'Alene, Idaho. Our board is local. We have no corporate parent. And so all of the margin that we earn, and we use the word margin very intentionally, it's not profit. Our margin gets reinvested into our organization, whether it's through wages for our employees, whether it's through capital, or whether it's through cash we have to keep for reserves. Any questions before we move on?
Any questions? No?
Okay. Well, there are some benefits to this new structure. Number one, we don't have any taxing authority. And also the county isn't on the hook for an organization that may or may not do well financially.
You know, real quick, it might be better just to pull the microphone a little closer to you because there's a lot of feedback coming from, I think, the speaker above you.
Is that better?
The computer? Okay, so the further away the computers probably might be.
It already sounds better.
Is that better?
Yeah.
Okay, scoot up.
Thank you.
It's an ear test too.
Right.
Yeah. There's a lot of benefits to this structure. You know, believe it or not, I'm getting more feedback here. Let's see. Is that better?
Yeah.
Okay. There are very few organizations, Kootenai Health size, that have remained in a district model. In fact, I think there's less than 10 in the country. It's mainly reserved for smaller hospitals and smaller communities. And so, again, we have a world-class board. We're still accountable to our local area, and we're able to do some things now strategically and financially that we weren't before, especially when you're subject to public meetings. Your competitors can obviously get a lot of intel that way, and we do have a competitive environment, which is important. We also have the ability to invest a little more strategically. As a district, we were very constrained by the investment vehicles we could use, and so that's a nice benefit as well. So who are we today? So we keep growing, as a lot of things do in North Idaho, so it's always good to make sure that people are aware of all that we do. We are the 3rd largest health system in Idaho, and we should say we're a system because the Coeur d'Alene main campus of Kootenai Health is certainly a major part of who we are, but we also have a lot of outpatient access, office buildings. We have a presence in Post Falls, presence in Hayden, and we also own and operate 2 critical access hospitals, one in Orofino and one in Clearwater. So if you didn't know that, they're part of our system. St. Mary's is in Cottonwood, and Clearwater Valley is in Orofino. So important to note that we don't just serve Kootenai County, though, anymore. We have a very, very broad service area. In fact, 35% of our patients come from outside Kootenai County. That includes Eastern Washington, I might add. It's not just an Idaho patient attraction. We attract people from Western Montana as well. And then certainly with our tourism industry, we see a lot of people who are here. Well, I shouldn't say a lot, but we do see people who are here on vacation that get injured or get sick, and that's a great thing for us to do also. But we are a very large institution now. You can see some of the numbers here. This we'll share with you a couple slides later is very much on par now with the Spokane hospitals, Deaconess and Sacred Heart. Some of our major services, we talk a lot about, we should talk about what we don't do because it's a much smaller list. But we do everything in the realm of specialty services as an inpatient hospital. So we're a tertiary referral center, level 2 trauma, heart surgery, neurosurgery, neonatal intensive care, oncology services. I mean, the things that we don't do are transplant. We don't do subspecialty pediatrics because Sacred Heart does a great job at that. No reason to compete with them. We don't do burn treatments, and we don't do sort of esoteric cancer treatment like a Fred Hutch would do, but pretty much everything else we do. And I want to call out behavioral health and women's. Behavioral health, we're the only inpatient behavioral health in this area, and we serve both adults and kids in that service line, kids above the age of 10, all the way through adulthood. We also have a crisis center in partnership with Heritage Health, and so we serve a really important need there. And then women's and children's, we're the only hospital birthing center and NICU in our region, and we do about 2,500 births a year and have a very high-level NICU to keep our smallest patients closer to home. And again, within a very, very large area, we're the only place that does that. So some bragging rights here. I think as we think of Kootenai Health as this region's healthcare system, you should have a lot of pride in the fact that we together have produced these great outcomes. And I say a lot that when you have an outside designation from one organization, that's kind of cool, but when you have it from 7 or 10, it starts to mean something. These are not things that we can buy. They're all based on outcomes and data, and they're all actually competitive within the country's healthcare system. So a lot of great things to call out. Michelle is most proud of our Standard & Poor's A rating, which is for financial health. And again, we should all be happy about that because that means we can invest, we can grow, and we can stay around for a long, long time, which is our goal.
And it's remained really solid even throughout the pandemic and financial recovery, whereas most health systems are still struggling to get out of that. So.
Yes, many health systems got downgraded in the last 3 years, so we were fortunate to avoid that. Not that we didn't avoid challenge, but we got through it well. Just to give you some perspective on our regional competition, I think a lot of folks who've been here for a long time think of Spokane as bigger, better, has things that we don't have. Well, in healthcare, that's not true anymore. Kootenai Health is on par or better in almost every large category. I mentioned transplant we don't compete in, and that's very intentional. And pediatrics, we have a small pediatric unit. But everything else, we're basically on par. And in fact, we're much larger than Deaconess when it comes to almost every volume category. Sacred Heart is a little bit larger than we are in some areas. Any questions about the current state of the union as far as capabilities and team and services?
Questions? Guess not.
Keep on moving us along. So Prairie Medical Campus, we announced this a couple months ago that we have acquired a 30-acre parcel of land in Post Falls at the corner of Highway 41 and Prairie Avenue to create a destination medical campus over the next years and decades in partnership with MultiCare, who is a Washington-based health system. And we've had a long history with them. I won't go through all these, but we have several joint ventures already. We work with them on our medical record system called Epic, and urgent care called Indigo, and some other things. So MultiCare is a very good system, and the next slide shows you some of their footprint. They're a Washington-only based system at this point, but much larger than we are. And we are basically capital partners with them. This project's going to be a lot of capital, and we want to make sure to keep investing in our current assets. So MultiCare is only going to partner with us on the Post Falls project, not Kootenai Health overall. But if you have any questions about MultiCare, please let us know. But they're a well-regarded system with a lot going on in their own right. To be sure, the Post Falls campus will be branded as a Kootenai Health asset with a minor brand for multi-care. We will also be operating the campus. So it will, for all intents and purposes, be an extension of Kootenai Health. So why invest in Post Falls? This is probably the Captain Obvious statement. The growth out there is tremendous, and these are just some numbers you probably know well, that Post Falls will exceed Coeur d'Alene here shortly in terms of population, and has all the room to grow north and west. And so we're locating right there with the orange or the yellow square at the southeast corner of Prairie and 41. And the heat map there is where the density of the population is expected to be, and so we're right in the middle of that, which is great. We also like the fact that this location serves Rathdrum, Athol, Hayden, that whole northern corridor, which is also growing, can easily access that, actually better than maybe coming down to Coeur d'Alene. This is just to show you all the development. I think this is very familiar to you. Lots of residential, lots of retail, lots of green space, and we want to be an anchor for this part of the community as well. And again, we want to stop as much as possible out-migration from Idaho to Washington. We want to serve patients here, keep Idahoans in Idaho, keep Idahoans money in Idaho, and keep jobs in Idaho. So just as a conceptual overview of the campus, this is what we plan. It's a phased approach. It's a large parcel. It's 30 acres. And so we can't build it all at once and want to leave room for growth. And so this is our phase one. Again, it's not exactly how it'll lay out, but it's a good representation of that. A large medical office, mostly outpatient services. That's where healthcare is moving. And we want to make sure to serve people closer to home, not only with the acute services, which we do have an ER there and imaging, but also with the pharmacy, laboratory, physicians' offices, and ambulatory surgery, which is, again, where a lot of the surgery is moving, is the same day kind of surgery. You don't need a big hospital to do that. And this gives you a little bit of a representation of what the phase one might look like. On the right is the freestanding emergency and imaging center connected to a major medical office building there. This will be modular, though, so we're going to add to it over time. And we love the fact that there's parking out there, because parking is a big constraint for us, as you know. And one of the major benefits of doing this campus is to decant our current campuses, which are a little bit overcrowded. And so this campus happens to be in Lakeland, Florida, but it is very similar to what we have in mind. These renderings put the potential buildings actually in the place where the land is. You can see this is actually the Rathdrum Prairie. And again, a lot of glorious parking there. And we envision over time adding to this campus. Again, our current campus is about 35 acres and this is 30, so it could be as major as this one, but we'll probably take on some distinct service lines and things like that. We don't want to duplicate everything. That's inefficient for us to do. But in many ways, this area, again, will be more densely populated than Coeur d'Alene is. And we also want to reach out to across the border. So Liberty Lake, those areas, we should take advantage of that growth as well. And patients, we already serve a lot of patients from the Valley and Spokane, believe it or not, but want to be more available to them also. So really quickly, kind of what it is and what it's not. It's a strategic partnership. It's not a merger or an acquisition. It's a joint venture. The micro hospital, which is the first phase, will have its own license, and it's important to note that. We hope to be cutting the ribbon in about 36 months, if not sooner. Of course, some of that has to do with, a lot of factors, but that's our plan. And then we will be the managing partner and the branded identity out there. Parkwood Properties, whom I think is very familiar to you, has been a partner of ours for a long time, is helping us with the development of the medical office out there and for the campus. And so we're thrilled about that, a local North Idaho developer working with us. So that is the Prairie Medical Center post-falls plan. Is there any questions before we move on to this?
Any questions? No?
Okay. I'm going to turn this section over to Michelle.
Thank you very much. Appreciate the time this morning. Want to talk a little bit about our community benefits specifically.
Just turn that off.
Just turn it off for a second.
Turn this off.
You can turn it back on. Just leave it there, it'll be fine.
Hopefully that's better.
Oh, that one over there.
Got it. Okay. So as we know, we are a not-for-profit 501c3 private organization and not a for-profit, which means that from a community benefit perspective, we take all comers regardless of their ability to pay. And all of the earnings that we've received, as Jamie talked about from a margin perspective, get reinvested back into either our community and our organization as well. And so from a community benefit perspective, we are closing the 2024 information, but we do have a high level currently of where we stand. From free and discounted care or uncompensated care, meaning that we are providing care free of charge, or that there are cases where patients are asking us for relief on their payments that they owe their liability, patient liability, or care where we have chosen to provide free care in terms of services, for instance, medication support. We are totaling approximately a little over $41 million that we provided in 2024. And then from donations and free services and programs in terms of training, accessibility, and teaching and so forth, we have donated approximately this was in 2023, we're finishing the books in 24, 20 million.
I have a question about that. How does somebody qualify for free or discounted or uncompensated care?
It's under the catastrophic category. So if a patient comes in through the trauma, for instance, in our ED.
ED, what is
Our
ED?
emergency department,
Okay.
sorry, I apologize. Where they may have insurance, and so the insurance pays for part of it, or, and they have their patient portion, so their co-pays or so forth, and they cannot afford it. We look and work with them to see, and sometimes because of the extensiveness of their bill, we may write it off and work with them to write it off. Other cases, if they come in and they don't have insurance, they have no ability to pay, and we look at we work with the patient, and many times we'll write that off and not have them owe any money to us.
So it's basically if they just can't pay you. Is there ever a situation where if they can't pay you, you turn them away?
Never, we cannot.
It's against the law, right?
It's against the law.
So I just want to make sure, I just want to differentiate. If we're giving people something, we're giving it to them. If they can't pay, we just write it off because it's a business write-off in essence.
Well, it's a write-off yes, it's a business write-off essentially.
Yeah.
And we're providing that care for them,
Yeah.
regardless of their ability to
Okay, all right, thank you.
Yeah, great question. We do have some great partnerships in providing for our community, which of course is a number listed there. Work very closely with them in taking care of our community members, and that is ultimately our mission and our goal. Do you want to talk about CityLink? We've had some questions around our CityLink partnership and what it is and what it is not.
Are you the best to speak to that? Kate?
I could give it my
Go
best
for it.
shot. So, we've been partners with CityLink since 2010, and we provide essential transportation for medical appointments, a lot to Kootenai Health, but then also to partners like Heritage Health and, even eye clinics, rehabilitation clinics, a variety of local clinics throughout the community here. And what this partnership does is it helps CityLink stay legally compliant. So if they want to have a fixed route transit system, you need to have a paratransit system according to the same one matching in a paratransit system. So our in-kind contributions offset CityLink's operational costs. In return, we have received several buses, but ultimately from 2017 to 2024, this partnership helped CityLink secure $5.5 million in grants. But we pay for all operational expenses of the program. Again, the only thing that we have received in return is 7 buses since this program started in 2010.
Just out of curiosity, is the Kootenai Health Transportation or the bus system, is that paratransit? Or paratransit is separate and your buses are actually outside of the paratransit network?
My understanding is that we are the paratransit portion of the services provided.
Okay, because from my understanding, there's separate paratransit buses that are not Kootenai Health buses.
I will get clarity on that for you.
Yeah, because we're aware that fixed route has to have paratransit, but paratransit is not the same as Kootenai Health buses.
Yeah, let me get clarity on that for you.
Thank you.
So just speaking to some numbers, we provide about 2,000 rides per month, so 24,000 rides annually. Of our rides in 2024, just under 900 were specific to Heritage, and again, several other hundred to clinics surrounding the area. Again, this has been a great partnership between not only Kootenai Health and CityLink, but also the Coeur d'Alene Tribe, and it's helped maintain mobility in the community the services that we're able to provide for our transportation, through our transportation team is really essential to the health of our patient population.
I would add, when we talk about the interlinking of public services, so EMS and fire, do a lot of our transport for acute emergencies. If we didn't have help people get to their appointments and get medications, and they would end up calling the ambulance, right? They'd have a worse outcome of some kind. It would burden that side of the equation. So it really does serve to help us do the right thing, for one thing, but also from an economic standpoint, it's smarter to do it this way than it is to wait for people to get sick or to miss several appointments and be burdening the EMS service, and then also the hospital's emergency room, which is the most expensive place to get care.
Mm-hmm.
Last but not least, I'll let you finish it, Jamie.
Yeah, thanks. Well, I do want to close with acknowledging the fact that we have a higher purpose. We are here for these reasons, despite whatever business or political winds might be of a certain era. We're really committed to these sets of things. We save life in a trauma or a heart attack situation. We welcome new life, which is a real blessing. We improve and extend life. So if you have a heart condition or you have a bad knee, we want to be a part of getting you back to a better quality of life. We help to inform and guide people to live their healthiest lives possible. And that's mostly our clinic and physician function, right? To prevent disease and prevent bad outcomes. We don't want people to come to the hospital. We really don't. We're just here when we have to be. We also reduce pain and suffering. So there's some things we can't cure, right? But we don't want people to suffer. And then we're here for the entire community. We want to be the rising tide that helps to float all the boats. And as Michelle mentioned, we don't turn anyone away for our services. That's not our primary objective. We want to make sure that the community is healthy because that really helps the economy of the community as well. So with that, we're happy to answer any other questions that you might have.
Any questions? No? Commissioner Eberlein? I'm just kind of curious. You mentioned connecting to Liberty Lake. Would you want the buses to be able to take patients over there?
Gosh, that is a good question. We have not even discussed that, honestly.
Yeah, because that would be part of your network, I would assume, so
It-
it would be transporting people across the state line.
I don't know, I mean, again, Commissioner, we have not even
Contemplated,
contemplated that.
yeah, okay. And then, does the Kootenai Health bus, does it serve every part of the county? Does it go to Harrison, goes to Athol, goes to Spirit Lake, it goes everywhere? And that's wherever a Kootenai Health patient is.
Yes.
So if someone's outside of the Kootenai Health, they want to see a different doctor that's not a part of the Kootenai Health network, they
So
probably
we do
couldn't.
give rides to independent practices as well.
Okay, and how would one find that if they would? Because that's not what I've heard. So that's why this is good because we can clarify a lot of things here.
Oops, sorry. It's not every single independent practice, but it is a good chunk of independent practices throughout the area. And I could get a more substantial list for you, just for your knowledge and awareness. I'll reach out to Sarah and provide kind of our service area map, how one would get looped into the services, and then also the clinics that we serve.
Because I think you said 897 trips to Heritage Health?
Yes,
Yeah, and that's not part of the Kootenai network.
right.
But it's a partnership, though.
So we partner with Heritage in other ways, for instance, like through behavioral health and what have you, kind of working alongside them with like crisis management and what have you. But as far as like partnering with their funds or what have you.
Yeah, financial
for the
partnerships.
transportation, no.
Yeah.
Yeah, they're owned separately, governed separately.
You know, for myself, this was a program that was started before I came on board as a county commissioner, and it just kind of flew through. It was about 3 or 4 months before I became a commissioner. And so when I kind of learned more about it, you know, my first question is, okay, what are we doing? Why is the county backing these grants for a private organization? I mean, you're a private organization. So as opposed to all people, you know, because it serves largely within your network and not outside your network. And I've talked with people at other places that have said, I would love to be able to do something like that. And so we would have to be the grant sponsors for other medical, organizations in order to provide their own bus system. And so shall we say, the questions that come to mind is, why would the county want to be in the business of picking or supporting certain private entities over others, depending upon the nature of, what that service is? And so I just want to learn more about this and understand it, because I don't think the government should be in the business of picking and choosing private sector winners, personally. I also, from my understanding, and I could be wrong, is that Kootenai Health could sponsor these grants themselves. They wouldn't need the county to actually sponsor them.
So when you say grants, could you clarify?
Well, the grant money that's used to pay for the buses.
So,
We should
Okay.
clarify that.
yes. Yes, because the 7 buses, you're right, those have come from CityLink and but
Everything else is.
we own and operate everything else and pay for the drivers and what have you. And again, I think it's important to also highlight that because of our partnership, CityLink's able to get over $5.5 million in just from 2017 to 2024 in grants. So that money doesn't necessarily come to us. It helps keep those programs running.
No, I understand that part. Then it just gets into, like I said, I've spoken with other people at other medical providers, and they said they would love to be able to have buses to transport their patients. But
Can they offer the same amount of match that Kootenai Health matches? And I think that's part of the key piece that we
Well,
need to look at.
the match hasn't even come into discussion. It was really just the fact that we would have to get additional grants to buy buses for their network, and then they'd have to figure out how to pay for that. That's just, again, that's part of the learning process of how this works. Because like when you mentioned it's part of the paratransit group, paratransit is open to everyone, but the Kootenai Health buses aren't. So I don't know how that could be a paratransit service if CityLink and the paratransit are open to everybody.
It's part of the non-emergency transport
Oh, no, I get that
portion
part.
of
I get that.
paratransit.
And so those are just kind of the questions that come to mind. I think overall, what you're trying to accomplish is great. I certainly don't have any issue with that. My issue is just the fact that, the county has been backstopping these grants for CityLink and so forth, but it doesn't serve the entire county. Apparently your buses do, so that's a little different. That makes more sense because we're the Board of County Commissioners, not the City of Coeur d'Alene Council or Post Falls or anything like that, where the market is much smaller. It's a subset of the entire county. So,
We appreciate that input. I guess, again, not coming in as prepared on that particular topic as maybe this question. But I think the one comment to make about the services, it takes critical mass, to do transit like this. And so CityLink is a separate organization, right, that we certainly subsidize quite a bit operationally, but they're the ones who get the grants. I don't know that the county gets the grants or even backstops.
It's the county.
it's the
The
county.
county is the recipient.
Well, that's
Yeah.
education for me. So,
Yeah.
So
Ci-
the.
CityLink is an extension, is the county.
It is the county.
Yeah.
So we should be agnostic to where the patients are trying to go, other than the fact that if it's a one-off office, right, there's a route. I mean, it's a public transit model. So I think the answer is not that we're directing patients to ourselves. It's that the Post Falls Medical Campus has multiple things in that area. Well, it stops there. And it goes to Heritage Health, which has critical mass, because it would be so inefficient to drop patients off onesie-twosie, So I think it's more of that than it is anything to do with direction of patients. Now, a lot of patients have appointments with us, which we get them to, but CityLink didn't make that appointment, right? So wherever the patient needs to go, CityLink will take them there.
Oh, no, I understand. And, we're just backstopping the grants for the buses. You're basically running the operation.
Yeah.
So
Well,
it's
we're
just,
agnostic to provider, other than the fact that there are some people that aren't on the route or are too distant or too
Yeah.
small.
yeah.
So I would think, and I'll have to confirm this, there may be a patient who says, I need to go, and we say no, because it's 30 miles away from our I would imagine if we have availability, sometimes they do make those special circumstances, but we'll get back to you on how agnostic we are, because I think that's kind of the fundamental question that you.
Well, I mean, exactly. The government is for the public,
Yeah.
and so we shouldn't be, picking, well, we like you, so we're going to backstop this program and help you. But, you're not big enough, so we're not going to help you, or something, that you don't want to take on those commitments. And then the only other question I have is, how do you plan on paying for your Post Falls campus?
So it's various ways. So as we said, with MultiCare, we have a capital partner. So they will be bringing in some capital. We'll also be looking at issuing debt and taking on some financing to pay for it.
Wouldn't the debt is the financing, right?
Different types of debt for financing, yeah.
Okay. How much do you think that's going to be?
The project is about 120-ish million.
Yeah. Okay.
Total, but we bear half.
Yeah.
Yeah. Wow. It's a big project.
For sure.
Yeah.
And then staffing too. You'll expand your staffing.
So we'll be hiring additional staff, but it will be coming from Kootenai Health specifically. So, and we'll be contracting for services. So all of our employees contracted through Kootenai Health to staff, physicians as well, engaging physicians and hiring physicians, and then bearing the cost certainly of capital and so forth to equip the place.
Well, that is right. You're in your bailiwick there, Michelle.
Yeah, exactly. Exactly.
Yeah.
She's the expert.
We're trying to figure out how to make it all work.
You'll,
We also
you'll,
don't want to starve our Coeur d'Alene campus.
Yes,
right?
exactly.
So we have other footprints we need to keep up. So it's a combination of, like an enterprise look, but certainly that project will take a lot of capital over time as it gets off the ground.
yeah. Interesting. Well, I wish you all luck on that.
Thank you.
It's
We need
ambitious.
it.
So,
Prayers.
any other questions? No? Okay. Well, thank you so much.
Thank you for your
Really
time.
appreciate
For
it.
your time today. Thank you.
Next up is public comment. Come on down.
Morning, Commissioners. Ron Hartman for the record. I think we all know there's a grassroots movement today to shrink the size of the federal government, to give control back to the users, drain the swamp. When President Trump took office in January, the first thing he did was secure the southern border. Second, he put Elon Musk in charge of shrinking the federal government. One of his campaign promises was to eliminate the Department of Education, return control back to the states. It is time the Kootenai County Commissioners follow the suit and reduce county government. The Idaho state legislation does not require the counties to provide a public transportation system. There is only one county in the state that provides a public transportation system, Kootenai County. The Kootenai County system, transit, has continued to grow since its beginning. It has added buses for Kootenai Health Hospital to operate. It has added buses for the Coeur d'Alene tribe to operate. The tribe runs service from senior living to the casino. It has grown in county headcount. There is now an interest by one commissioner to build a new building for the purpose of doing maintenance on the buses. As it stands now, every property owner in the county is taxed to run transit. Yet the transit system only provides services to people living in the cities of Coeur d'Alene, Post Falls, Hayden, and Dalton County, Dalton Gardens, plus Kootenai Health and the Coeur d'Alene tribe. This county transit system needs to be turned over to the users. If the users do not want to accept control, the system needs to be shut down. The end game for the county is to get out of running a public transportation system. A timeline with total cost to shut down transit needs to be completed before next year's budget is approved. It should include the savings for selling all the buses. Thank you.
Thank you. Anybody else? Anybody on the line? No?
The
10:55.
The only thing I'd add is Shoshone County actually does run their transit system. They have a contractor that does it, but they're responsible for all the grants and all the
How long have they been
Finance.
doing that?
I don't know, it's been many years.
They don't receive FTA funding, though.
They do.
No, they do not.
Uh,
They do not receive FTA.
You want to come
So
up?
is it
and-
ITD funding?
Yeah.
Okay, so ITD funding is still FTA pass-through.
No, it's not FTA pass-through, but it's federal pass-through. It doesn't come from FTA. ITD does not come from FTA.
Okay, well, so that's not federally funded, it's state funded,
It's federally funded.
Funded, but through a state program, but it's not FTA funded.
so it's a state program, but it's not FTA funds, so we're not getting it, they're not getting it directly from the federal government, it's going through the state.
Yeah, and that's
Okay.
what we do too. We have ITD funds through the state as well.
Yeah.
Well, thank you for your public comment. Is there anybody else? No? 10:56, meeting adjourned.